Thank you very much. It's a privilege and a pleasure to be here today. Now, I think most of the people here, most of you will know what this dreadful disease is. I thought I'd start by just framing what I want to say by recognising how awful this disease is. It's an aggressive malignant disease, almost always with a fatal outcome. There are nearly 2,500 deaths per year, and the epidemiology suggests that we may not have reached the peak just yet. And it's an epidemic waiting to happen. It's an epidemic in developing nations. These are some pictures of diagrams of the disease. It's mostly associated with the lung, but it does affect other organs as well. But as I say, most people here are very familiar with the nature of the disease. It's one of those diseases which gives clinicians and researchers a tremendous challenge. There's a very long incubation period, over 20 years in many cases. By the time the symptoms appear, the damage is irreversible. There is no cure as yet, and very little can be done at the present time except to ease suffering. But I don't want to start on a completely negative note, because I think we need to have optimism. There are other diseases which are in this position. Hypertension is rather different, but it's an example of an insidious disease which the early 20th century had a long incubation period. By the time you knew your organs were damaged by hypertension, the damage was irreversible. There was no cure at the time, and very little could be done for you in the final stages. And yet that's a disease which we've cracked. So what are the research funding organisations currently doing? It's fair to say it's not an area which attracts a large amount of research funding. That's something which all of us would like to change. But there is activity going on. So the two largest public sector research funders are the MRC and the National Institute for Health Research. We're spending just over £2 million per year. They're projects in the Medical Research Council's toxicology unit, and they're two clinical trials which are being supported through the NIHR. The insurance industry has donated £3 million. Just over £2.5 million of that is for research, and that's gone to fund 17 different awards, and there's a whole range of things that's been done with this money. Been channeled through the British Lung Foundation. They've awarded grants for a bioresource, project grants, pump priming grants, and PhD studentships. And the interesting thing about that package of research that's been supported is that it's doing the sorts of things which you would expect a balanced, integrated research program to do. It's providing some sort of infrastructure. That's what the bioresource is doing. It's providing research funding for research grants, which is what the project grants are doing. It's pump priming new ideas, but also it's building capacity. And I think everyone recognises that's an important issue. So the question which I get asked frequently is, well, why isn't more being done? Is it that the research funders have other priorities, don't want to spend money on this area? The problem is not that we don't want to spend money on this. It is simply that there's been a lack of research applications so far. Now, there is good research there. We've seen that through the funding that the British Lung Foundation has been able to release. But the fact is that we haven't been overwhelmed by large numbers of research applications. Now, I think there are a number of reasons for that. That I think there's a perception that maybe the research funders don't react warmly to this particular area. That isn't the case, but it is, I think one has to say, a very difficult area in which to do research. At least it has been historically. We've seen this with other disease areas which people have tended to avoid because it seemed to be too difficult. Now I think we need to challenge that, and I'll come on to this in a minute. But it is an area where we would be very happy to see high quality research proposals. So, when you're looking at a disease, there are a number of things that you're going to be looking at. Obviously, to understand the epidemiology, and we know what causes most forms of mesothelioma. You want to understand how the exposure to the original toxic material actually creates a reaction and pathology. We don't fully understand that. You want to know what the markers are of incipient disease, particularly with a disease with a long incubation period, ways in which you can spot the disease before it's too late, but also as a way of identifying drug targets. That leads on to candidate drugs, evaluation of drugs, and if the drugs are unsuccessful, then palliative care. Now, research funders do different things, and I just wanted to put up this diagram here. What we're moving from is invention, is discovering new things, evaluating new ideas, getting them adopted in health and care, and then ensuring that they're diffused throughout the health and care system. The sorts of research which typically the Medical Research Council and charities like Cancer Research UK, for instance, support, tend to be at that very much upstream end. It's about the basic discovery, it's about the translational research. Where the National Institute for Health Research comes in is rather more downstream, which is, it's also translational, but it's about evaluating different interventions. And that is important. You may wonder, why am I telling you this? I'm not here to tell you about the National Institute for Health Research, but I think it's important that you understand where different funders can play a role when we look at what needs to be done. So, what are we doing? So the first thing we're doing is this priority setting partnership, trying to identify the 10 most important unanswered questions which patients, people with the disease, their families, research charities, other charities supporting people with mesothelioma, and clinicians feel are the most important questions. And that's what we're setting off today. The next thing is to raise the profile of the disease. Now, the charities are doing a fantastic job here about raising the consciousness of the general public and also opinion formers about the significance of the disease. We too want to do our bit by reminding researchers that this is an area that we're interested in, where we would like to receive research proposals. There has been a debate about whether the so-called lack of research proposals, is it a lack of research proposals, is it a lack of high quality research proposals, is it a lack of high quality? Well, we've got an insurance policy here. We have a thing called the Research Design Service, and that's there to help people develop compelling projects. There's a particular challenge with the sort of evaluative research which we fund in the NIHR, because it's not simply about getting laboratory scientists together, clinicians together, it's about getting other skills, statisticians, people who know how to run clinical trials, people like that, and health economists. So the design service is there to help. But I spoke earlier on, I made this distinction, and of course it's actually a spectrum, it's not a distinction between the more basic research and the more evaluative research. And any pipeline needs stuff going down it. You need a tap at the beginning, you need the ideas to be discovered, and you need those bright ideas to be translated. So what the National Cancer Research Institute is doing is organising a meeting which will bring people, researchers together at that more basic translational end to try and identify new approaches to looking at this disease. It worked well in other areas. If we think of lung cancer itself is an area which is changing through the introduction of new techniques and new approaches, and other diseases. For instance, there was publicity recently about a new drug for treating breast cancer, in fact for preventing breast cancer, which is exploiting particular characteristics of particular individuals. So this is all about things like stratified medicine. So I'd like to finish by just, as in a sense, passing over to Catherine for the next stage. I'd like to acknowledge the work of the James Lind Alliance and of the mesothelioma charities that are involved in supporting this work. I'm very grateful, and we look with great interest to the outcome of the work. Thank you very much.